This presentation will be by Sonali Sadequee, who's the founder of Sustainable Wellness and the creator of the Conscious Communication Training Program. As a professional Imago facilitator, she integrates heart-centered conflict management, yoga, breath, and neuroscience principles to support individuals and groups and help them create safer, more trusting, and therefore more connected relationships with each other. She helps clients develop the communication skills necessary to help build, nurture, and sustain empathy, depth, and meaningfulness in their relationships, especially in situations related to fear and trauma, which of course a melanoma diagnosis is. Also, situations related to power and privilege, which dealing with healthcare has that. Through her coaching services, Sonali helps facilitate conversations that help people turn wounds into wisdom for deeper transformation and resolution in their various relationships. In group settings, her function is to facilitate a safe container in which participants communicate their relational needs and their desires effectively. So, Sonali, if you can upload.
Oh, sure. I will go ahead and screen share. So thank you for that. Thank you all for having me here. And really appreciated Dr. Baer's presentation. Relationship is it can be such a tricky thing to balance when we're already balancing so much, when we're already trying to have so many spinning plates, dealing with the diagnoses, dealing with the medical care, and dealing with our own, the challenges and the emotional experiences that come. And if we can set ourselves up in supportive environments, right, and also give the proper support that is needed, then the experience of going through the cancer and the treatment can become so much more tolerable. It can become so much more graceful. And that's really what my hope is that some of what we're about to talk about today, and of course we can only introduce these tools to you. We won't be able to get deep into them today in 15, 20 minutes. So, but these tools are specifically designed to help us do two things: manage our own stress and be able to better self-regulate and deal and handle the stresses and the reactions and the fears and all of that comes up, and also co-regulate, right? And so how we actually are supporting each other, how our loved ones are supporting us, and how we are also showing up to express ourselves and our care, and how the caregivers are also speaking with us, expressing, and how is that whole dialogue happening? How are all these conversations happening? So I'm gonna go ahead.
Okay, Sonali, do you think you can increase the size of the slides there?
There we go.
Yes, wonderful. All right, wonderful. And then if we can have the next slide, I guess. The part of this, the self-regulation piece of this, is based on the community resiliency model. It's exercises that are designed to be done in 5 minutes or less, recognizing the time stress that's on caregivers and on patients. And you can do these throughout the day for practice and also when confronted with difficult situations. And the primary goal is to help you connect to your best self, manage all the feelings that are gonna come up, like anger and frustration, dealing with stubbornness, and manage those so that you confidently make decisions and choices. There are grounding videos. There's an app called the iChill app that this particular model has offered. But I think perhaps the best thing that we can do is to ask Sonali to take us through a grounding exercise.
Okay, thank you. I also wanted to say that any of these links that you see that are underlined, they're actually links to resources where you can plug in and understand more of the depth of information that's behind that. So what I'm about to share with you is an actual practice. It can take, when you practice, this can take as quickly as 2 minutes, maybe even 5 minutes. So I'm going to invite you to actually join along for this practice called grounding. So you are welcome to join along or simply watch and listen as well. If you're joining along, then I want to invite you to go ahead and get comfortable wherever you're seated right now. Just maybe like shift and maybe lean back. You don't have to sit up tall or anything. Just get very comfortable, whatever that feels for you. Then, grounding refers to bringing your attention to your body in the present moment by noticing how your body or part of your body is making contact with the surface. You can ground by sitting, by standing, lying down, finding a position that is simply comfortable for you. As you bring your attention to the places of support, notice your breathing right now. Notice your heart rate and your muscle relaxation. The places inside that feel more relaxed, more pleasant, or neutral. Next, bring your attention to your back, your lower body, your legs. And if you are sitting, notice how your feet are resting, either on the floor or on the footrest somewhere, perhaps. Bring your attention to the sensations that are calming or neutral in your body, and take your time here. As you bring your attention to a more neutral or pleasant sensation, and notice your breathing here, your heart rate, your muscle relaxation. If you become aware of anything that feels uncomfortable or even painful, then see if you can shift your attention to a more comfortable or more neutral place. And then notice the change. As a way to bring your grounding practice to a close, slowly scan your body from top to bottom, head to toe, bringing your attention to any places inside that have changed in a more pleasant or neutral way since you started. And take your time here. When you are ready, bring your awareness back to the room or the space that you're in. And if you need more time, take all the time that you need to gently allow yourself to open your eyes again as you return to your presentation. So thank you all if you joined that with me. You might notice a slight difference or not, and just know that the more we practice some self-regulation practices, and this is just one of many examples, your nervous system becomes more and more accustomed to allowing itself to come to a more calmer and more grounded place.
So this is an example of self-regulation, and it's basically taking responsibility for yourself. It's in not only responsibility, but control, that you have a good amount of control over some of your reactions and your ability to keep those reactions from getting out of hand. Now, co-regulation is something different. It's supporting each other. In the way we can do this to have effective conversations, basically not conversations that wind up in anger and in finger pointing, in judgment, in biases, lack of curiosity about the other person. But this co-regulation is based on essentially being able to create an environment for each other where we help each other. And Sonali will tell us about that.
So what you just practiced was self-regulation. And so now I want to share a little bit with you about co-regulation. So co-regulation is really a communication tool, practice, right? It's what happens when we communicate a particular way that helps us to create a kind of like an energy, right? An environment, offers a fertile ground for us to support each other's nervous systems. And there's a lot of different kinds of conversations that we're having on a regular basis that elicit, right, different kinds of emotional experiences. And the kind that we're talking about today, that is what conscious communication program teaches us, is that it is specifically designed to create a more supportive, a more congruent, more connected, a more safer relational experience with each other, so that we really feel heard, we feel gotten, we feel like we're able to express ourselves in a safe way, right? In a way where we're going to be heard, right? And so, and clearly, right? So we're really maximizing harmony in the relationship and in the conversation. We are supporting a deeper connection, right? So that all the conversations that we all have to have with, amongst patients and healthcare professionals and loved ones, it's as harmonious as possible. And the conscious communication tool actually helps us to do that. Okay. In this model, one of the things that we teach is that there are very specific roles. When one person is speaking, the other one is listening with the intent to specifically listen, right? And when we're speaking in a way where it's consensual, like we have, especially if we're talking about sensitive topics, right? We want to make sure that we get consent to share some content so that the other person who's listening to us, they're really available, they're really present, so that we're not talking at each other, we're talking with each other. And as a speaker, so I'll share the speaker responsibilities, is that we always speak from I kind of statements. So we just say, I feel, I need, I want, or I prefer kind of statements, so that we're not doing any kind of finger pointing, where we're not focusing on, oh, you did this or you did that, because a lot of times that can actually create discord, lack of harmony. We're also succinct in what we share. We get to the point. We're not accusatory, right? Because we know when we accuse each other, that can throw up our defenses and get our egos involved. And then before we know it, it just becomes a very ineffective conversation, right? And we're non-judgmental as much as possible. So these are just some basic principles of the speaker responsibility. There's a lot more to learn about this. Now let's go into the listener responsibility. When we're actually listening, we listen with the mirror to duplicate or mirror what we are hearing exactly as the person said it, or as close to as the person said it, right, as much as possible, without interpreting. Because what we do know is oftentimes when we're interpreting what the other person said, we can actually misinterpret. So it's not about interpretation. It's really about just mirroring exactly what they said. So it's what we call active listening. Then we make sure that we really heard them. We say, did I get you, right? And then we give the person, the speaker, opportunity to really fully share. We say, is there more, right? We validate the speaker, whatever they're sharing, and we really turn up the volume around empathizing, right? Really, and these are high level kind of communication skills. It really involves the head and the heart, and it takes practice. It is not easy, especially the listener role. It's not easy, and the speaker role. It's not easy for different reasons. And as the listener, we also do not give advice unless it's actually intentionally sought or asked for. And we listen fully until the speaker is done. We do not interrupt them, and we do not hijack the mic. We don't start talking about our own self.